Hi, I'm Ginny Davis, Community Relations Coordinator for SpiriTrust Lutheran Home Care and Hospice. I've been with this agency for over 16 years, and I love providing information to family members about navigating through the journey of hospice. It's such a scary and unknown time for families when a loved one is dealing with a terminal illness. And just knowing that you can get clear, concise answers to your questions can make a big difference in moving forward. Hospice is provided when continuing curative treatments will increase suffering while not providing a positive change in the person's condition. Normally, a physician will make a hospice diagnosis when a client has been deemed to have 6 months or less to live. Hospice also is looked at when there is increased hospital visits or trips to the ER that result in a decision for comfort measures only. The goal of hospice is no longer quantity of life, but quality of life. Hospice is paid for through the Medicare or Medicaid hospice benefit and through most private insurers. If a client does not have coverage, hospice will work with the person and their family to ensure that needed services can be provided. Many hospice agencies have benevolent care that will cover the costs of service if there is no insurance benefit. Some things a family would want to look at in choosing a hospice agency are: do they offer an initial informational visit to get basic information on services? Do they have a 24/7 on-call staff? Ask what the hospice staff can do for the uncontrollable pain at home. How does hospice cover the need for respite care? This is the care that is given to a loved one when the family needs to have a break. They need to get away, maybe go on a vacation, go visit other family members, just basically go out and do daily activities. Is the medical director full-time for the agency? And are they certified in hospice and pain management? Another very important question is, what distance does the hospice nurse have to travel to get to the client? The family will be expected to be present during the sign-up for their loved one for hospice services. They play a key role in the overall care for providing feedback and communication with the hospice staff. The hospice team is a family-centered approach, and it includes a team of doctors, nurses, home health aides, social workers, chaplains, trained volunteers, and family members. They all work together to focus on the needs of the hospice client. In many cases, family members or loved ones are the client's primary caregivers. Hospice is not just for the client, it's also for the family members. The team works with the family and the caregivers to help them understand what to expect, to teach them special caregiving techniques, and to help them with emotional difficulties as well as grief. Palliative care is the management of pain and acute symptoms through home health. It can be their nurses, their aides, and they are specialized in symptom management under the direction of the client's physician. The palliative care certified medical director is also available for consultation as needed. Clients do not need to have a life-limiting illness, and many continue all treatment options during their care. Palliative care is covered under the client's home health insurance. Many times, someone will start palliative care, and as their prognosis progresses, they will continue in transition onto hospice care. Many hospice agencies offer 13 months of bereavement care following the client's death. Those services can include individual or group support and also grief counseling. Some of the other services that are offered and provided by volunteers are things like pet therapy, massage therapy, music therapy, prayer shawls, memory bears, and celebration of life services that are held each year for the family members and the loved ones. I've actually brought along 2 samples of some of the things that we do at SpiriTrust Lutheran Home Care and Hospice for our family members and also our hospice clients. This is a prayer shawl, and our volunteers knit these or crochet them. We have many that are brought into our offices, and they're just beautiful. They are offered as a gift of love from our volunteers. And basically, the hospice client can use these to cover their laps or their shoulders. And when they are no longer here, the family members can have this as a remembrance of them. Another thing that we have are our memory bears. This happens to be mine. I use this when I go out to my senior fairs. But these are made for each specific hospice client. The family member sends in a particular article of clothing, maybe a piece of jewelry. We've actually have had some hats sent in, and our volunteers use those items. They cut them and sew them to fit our bear, so that the little bear then is again given to the family members as a keepsake. A list of client rights are normally given to the family at the time of admission. Some of those include the right for a client to receive effective pain management and symptom control. Also, to be informed of options, to be informed in the development of the plan of care, and to be treated with respect and dignity and without prejudice. I hope I've been able to answer some of your questions with regards to hospice care. I can tell you it's a wonderful service that is provided, again, not only to the hospice, our client, but also to the family members. Thank you.